In a medical emergency, time is of the essence and can be the difference between life and death. May is Stroke Awareness Month, and time is one of the most powerful tools in a doctor's arsenal in treating stroke to prevent irreparable, devastating damage to the brain. According to the American Heart Association, someone in the United States has a stroke every 40 seconds, and it's the leading cause of long-term disability. We are about to share critical life-saving information with you about this disease that we hope will empower you should you or a loved one ever become stroke's next victim. I'm Tamsin Fidel, and this is Stroke. Every second counts.
911, what's your emergency?
In our special, we'll review the warning signs and symptoms of stroke, who's at risk, prevention, and the latest advancements in treatment, including cutting-edge telemedicine technology. Telestroke is revolutionizing how doctors can treat stroke patients and improve patient outcomes.
Stroke is essentially brain damage caused by disease of the blood vessels in the brain. The different types of stroke include hemorrhagic strokes, which are caused by ruptures or bursting or leaking of blood from the blood vessels, or what we call ischemic strokes, which are clogs, where a blood clot forms somewhere, travels into the body, and blocks blood flow to the brain.
The face of stroke may surprise you. Vibrant 42-year-old Yarmila Steele is a wife and mother to 11-year-old Mikey and 6-year-old Danielle.
Monkey, you're a monkey.
Yarmila is also a stroke survivor.
Something was telling me maybe I do need the ambulance, but I did have a bad headache.
Anybody can have a stroke, even children. But most of the time we think of stroke as a disease of the elderly. So people over the age of 65 are at higher risk of stroke than younger people, but almost 1 in 4 people who have a stroke are under the age of 55. And there are certain people who may have strokes in their 20s, 30s, or 40s. You can't think to yourself, well, this person's too young to be having a stroke. I'm not going to call an ambulance. You have to consider that even if they are younger.
Little did Yarmila know one spring afternoon last year while driving her daughter to soccer practice, she was having a stroke.
I had to go pick up my daughter because she had a soccer practice, and drove her home to get dressed and then drove her to the soccer field for her practice. You know, I felt kind of odd.
When she arrived home, her husband Chris noticed something was definitely wrong.
Well, the first thing I noticed when we were sitting directly across the table was that after she had said she had a headache, I noticed that one of her eyes was a little bit off. It wasn't like they were both focused in the same spot. Less than 5 minutes, she started getting the symptoms of a full stroke. Like, she said that she could feel tingling, like on her left side. And she walked from the chair to here, which is 6 feet. And by the time she got here, it was getting progressively worse. So, I mean, thank God the EMTs, they came within 15 minutes.
From that point, I don't remember 2 weeks of my life.
Thankfully, Chris took action immediately and called 911.
911, what's your emergency?
His swift response saved Yarmila's life. She suffered a hemorrhagic stroke caused by a leaking or burst blood vessel. Yarmila was treated at Overlook's Comprehensive Stroke Center. When CAT scan imaging revealed Yarmila had a hemorrhagic stroke, she was taken here to interventional radiology. Overlook neurosurgeon Dr. Paul Sapphire performed life-saving surgery on Yarmila's brain.
Yarmila presented with a very deep and severe intracranial hemorrhage that was located primarily in the deep fluid-filled space of the brain called the ventricles. She had what's referred to as an intraventricular hemorrhage. And when she first presented, she was in the deepest of comas. And in fact, her neurological exam was so poor, she had what we referred to as a brain-dead exam. She wasn't breathing on her own. She had no reflexes to speak of. She had no voluntary movements. She was unaware as to what was going on in the world around her. This is Yarmila's initial CAT scan when she first presented to the emergency room. And this CAT scan, this white on the circle on the outside, that's her skull. This is her brain in the middle. That's the front, that's the back. This is the left side, this is the right side. And all this whiteness here represents bleeding or hemorrhage within the ventricles of her brain. And you can see that they're deep and located right in the middle, the center of the brain.
When doctors delivered the grave news to Chris, Yarmila's husband, he had faith that she would fight for her life.
No matter what they said and how horrible it was, I knew that somehow if anybody could get out of it, she's not. She's not going to sit there and die. I mean, she's really very persistent. She's loving and kind and great with the kids. And yeah, I really love her.
I love you too.
Glad to have her.
Using cutting-edge technology called the Apollo, Dr. Sapphire was able to stop Yarmila's brain from bleeding.
The Apollo device works with a couple of other special products that we use simultaneously. The first thing that we do is we generate a very specific either CAT scan or MRI, in this case of Yarmila's brain, which allows us to place that information into a special computer at the time of surgery that enables us to see where we are in a three-dimensional plane at any given time. And then we're able to make a very small incision and a very small opening, again about the size of a dime, in the skull. Through that small opening in the skull, we can place a very thin tube into the deepest parts of the brain. And then through that tube, we advance the Apollo device. And that Apollo device is a mechanism where we can literally aspirate or suck out the blood clot, as well as macerate it with a small little, almost corkscrew-looking device. And that allows us to break up the clot, that hemorrhage, that blood, and remove it in its entirety. Because of the location of where this hemorrhage is, the Apollo device allows us to go with a very small and surgically precise method to get into those deep parts of the brain, remove the hemorrhage, and damage very little of the surrounding brain.
Yarmila's recovery has been astounding.
Do me a favor, stare as best you can right here at my nose, okay?
With the exception of some vision challenges, the procedure gave Yarmila an amazing second chance at life.
That hospital and those doctors there are absolutely amazing. I would not be here today if it wasn't for them. I mean, they saved my life.
A chance to continue being wife and mom, a precious gift her family is forever grateful to have received.
My mom means everything to me. I love my mom a lot. My mom takes care of me.
Yeah, I look forward to being together with the kids and having a long, long life of different adventures as long as we're together.
And now this is Yarmila's post-operative CAT scan, and you can see in that deepest centermost portion of the brain, all that white has now turned back to the normal appearing black, which is normal fluid that should be there.
Slowly, if you work hard, you can overcome those obstacles and get back to normal.
In addition to hemorrhagic stroke like Yarmila had, there is also ischemic stroke.
In ischemic strokes, you can see the blood supply to the brain here. This is the carotid artery, and you can see forming up here in this corner a plaque or atherosclerosis. And as part of that plaque, you're going to get blood elements like blood cells and platelets that form a blood clot. What can happen is that blood clot can be picked up by the blood, travel into the brain, and as the arteries get smaller, it lodges in that artery, and that part of the brain doesn't get blood flow, and that causes damage to the brain that we call a stroke. If you're having the symptoms of a stroke, that is a true emergency. That's when you want to use the 911 system and the ambulance system. You don't want to delay care, and you don't want to have a friend drive you or try to drive yourself. So you want to call 911, use an ambulance. If it's possible, you want to go to a place that specializes in stroke care. We call these stroke centers, and they're usually certified by either state or national agencies. Stroke centers, especially comprehensive stroke centers, have techniques and devices and testing that can be done quickly and may not be available at other emergency rooms.
Knowing the symptoms is key. The acronym FAST, F-A-S-T, is an easy way to remember the sudden signs of stroke. F, face drooping. Does one side of the face droop or is it numb? Is the person's smile uneven? A, arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S, speech difficulty. Is speech slurred? T, time to call 911. If someone shows any of these symptoms, even if the symptoms go away, call 911 and get the person to the hospital immediately, and check the time so you'll know when the first symptoms appeared.
When a person is having a stroke, it's like a stopwatch has started. The damage begins nearly immediately, and the damage occurs over about 3 to 8 hours. If a person can come to the emergency room quickly, we can oftentimes reverse the process and prevent damage to the brain.
Time is critical. Doctors have a short window in which to save precious brain cells during a stroke. It is a race against the clock.
Time lost is brain lost.
Once a patient is evaluated by the stroke team, a CAT scan will be done to obtain imagery of the brain that would reveal if a stroke did occur.
During a stroke, a person is losing 2 million brain cells per minute. That's a lot of brain damage. We do everything we can to reverse that damage, and the sooner we can treat a person, even if it's a matter of minutes, makes a big difference. The drug Alteplase, commonly called TPA, is a clot buster. It basically is given by vein and goes into the blood vessel and chews up the blood clot, allowing restoration of blood flow and trying to prevent and reverse any damage that has occurred.
Here at Overlook Medical Center in Summit, New Jersey, the Stroke Center is making great strides in cutting down the amount of time it takes to treat a stroke patient who arrives at the ER. Inside the ambulance, groundbreaking telemedicine technology is making it all possible.
Hi, Dr. Belt. You have a stroke for me?
Calling for a telestroke consult?
Okay, I'll pick up right now.
Can you tell me the story, what happened to you?
This is telestroke technology. It's a game changer for diagnosing stroke. When called to a stroke emergency, paramedics carry this portable device into the ambulance and immediately connect with a stroke neurologist who uses a laptop or an iPad to conduct a rapid evaluation before the patient arrives at the ER.
Go up high. Go up in the upper quadrant.
Let's have the patient follow your finger to the right. Good. Now go to the left. If we use the telestroke technology on the ambulance, as opposed to having the patient come to the emergency room, for saving brain cells.
1, 2, 3, 4, 5. You can put it down.
Paramedics are the first line of defense in carrying out rapid treatment for a patient. What you're watching is a reenactment by Overlook Medical Center and its comprehensive stroke center team to help illustrate how telestroke technology would be used in a real-life emergency.
One of our physicians, our neurologist from our stroke program, is going to connect. He's going to ask you some questions so we can start assessing you before we get to the hospital. Hi, Dr. Bell.
What's my paramedic's name?
This is Dave.
Dave, okay. Patient, what's the patient's name?
This is Oliver, 45-year-old male.
Okay.
And he is having some left-sided weakness and numbness that started right around 6 o'clock while he was eating dinner with his wife. She witnessed it. History of hypertension and high cholesterol. He takes Lipitor, and he takes lisinopril.
Okay, let's go through the exam.
Okay, Dave, hands out front like this, please. Oliver, put your hands out.
Up here.
Turn them over, please.
Thumbs up.
Pick them up a little higher. And now, let's see. Let them go, Dave. Let's see where they
Try
go.
to hold him there, Oliver.
Close your eyes. Close your eyes, Oliver. Okay, fine. You can let it go. Okay, Oliver, put your hand down. Oliver, keep your eyes closed. Dave, I want you to touch one hand, then the other, simultaneous, and ask Oliver where he's being touched.
Okay. Oliver, where am I touching you right now? Which side? Okay. How about now?
My right side.
Okay. How about now?
My right side.
Just on the right. Okay.
Okay, so he's extinguishing left, right, Dave?
Correct. Only feeling on the right, not on the left.
Okay. Dave, I want you to have Oliver lift up his left leg and hold it up off the stretcher.
Okay. You lift up this
Okay,
left
bring
leg.
it up for me. Try to hold it up.
Okay. Can you hold it there?
Count of 5.
Hold it there for 5
1.
seconds.
Okay, let it go. How about the right leg?
Okay. Hold that up there.
Keep it up there, Oliver.
5.
Count of 5. 1, 2, 3, 4, 5. Okay, you can put it down. Okay, Oliver, I believe you're having a stroke involving the right brain. It's causing you to have left-sided weakness. Dave, how far are you from the emergency room?
About 7 minutes right now.
Okay, I'm going to call the ER, just let them know the story so we'll be all prepared for him when he arrives. Oliver will be doing a CAT scan when we get there, and we'll be talking about some medication to try to help you out, okay? Very good. I'll pick up with you in the ER.
Okay, we'll see you there.
So this is the emergency room in Chilton right now. Their trauma center / stroke unit. And again, we see the empty bed now, but this is what it will look like. In fact, this is what they're seeing. They're seeing us right now, Tamsin.
So this would be you.
This
and
is
then
us.
if that's a patient, you'd be able to zoom in to
Exactly.
the patient?
In fact,
so
I can zoom in
how
like
does that
this.
work? Okay.
I could zoom in real close if I want to.
And then that's how you're able to talk,
Yes.
to see the patient and
Very closely. I'm communicating with the nurse via our microphone to do the exam. The other thing I can do here, I can show the patient images and ask them, what do you see here? Can you describe it to me? So the patient I'll have an idea of what their language is like. I ask them to describe it, and I can listen to their language abilities. Plus, if they're ignoring part of the picture, then I know they have a visual field defect as well. So this is a very important picture. And then I have other things. Can you name this object? How about this object? And I'll go through different objects, naming. And then I'll ask them, can you read this for me? Their ability to read. Because patients with left-sided strokes will have difficulty in reading, so we have different reading tasks for them to do.
Hi, sir. I'm the ED physician. Do you know what happened to you?
I was having dinner
Uh-huh.
and I just couldn't,
And you couldn't move?
no, I couldn't chew.
Okay. Can you do me a favor and lift up your hands, please? Please? Uh-oh. That's not good. Okay. Smile again for me. All right. Registration. Do we have the chart? Complete. And it's already tagged. Please start to CAT scan.
Yeah, right here. I'm gonna take you from the stretcher and put you on to another one.
1, 2, 3. Excellent. I'll move this out of everyone's way.
Hi, Dr. Bell.
Hi.
Can you see the patient?
I can see the patient well. Oliver, I want you to follow Angela's finger to the right. Open your eyes wide, please. Keep your head still. Eyes good. Okay, other side, please, and hold it there for a moment. Can you open your eyes wide? I can't see very well. How about the left eye? Can't see that one. Good. So the odds are that he's going to do better with the medicine than without the medicine. If we do nothing, there's a very good chance that Oliver will not have any change and he'll be left with left-sided paralysis.
Okay. 7.2 of alteplase going in.
Dr. Bell, we're gonna hook up the IV.
Great.
You're gonna
Listen,
feel
from the
it.
time he came in until the time he got the bolus, it was 21 minutes. That's incredible time, everybody. Real good job. I've been in practice for 28 years, and telestroke technology I've only been exposed to for the past 2 years that I've been here at Overlook. But prior to that, in my private practice, I would get a call from the emergency room during a busy office day. I would assess the patient by phone, and speaking to the emergency room, I would never see the patient. And then either once I stabilize patients in the office, maybe within the next 30 to 60 minutes or at the end of the day,
All doctors to the ER.
I would go into the emergency room and see the case. Usually, though, they were seeing me after they'd already received the TPA. And the fact is, there are a lot of patients that don't have strokes that were receiving TPA. So it's good to have a stroke neurologist see the case immediately. What telestroke has done, it's allowed me to be able to break for a few minutes do a telestroke here in the office, make sure the patient truly has a stroke, give the right care, then go through the rest of my office and then assess the patient later.
61-year-old Barry Rogers knows firsthand the power of telestroke technology.
I believe telestroke saved my life.
On February 11, 2016, Barry Rogers started his day as he usually does by making a protein shake. But this morning was very different.
And when I reached my arm in the pantry, it felt like I got a shock. It startled me, and I pulled back. I said, whoa, what was that? And I opened the shake, and this is when I first noticed something was really wrong, was there's a scoop inside the shake. And I reached my hand inside, and I could not grab it. I started getting a sensation of a tingling sensation throughout my body. I called my wife. I said, "Hun," and she's with her back to me. She said, "What?" And after that, I could not talk anymore. And she turned around and faced me. She said, "What?" And I just looked at her. And she said, "Stop playing. Come on, I have things to do." "What?" And all I could do was grunt. She said, "Are you having a stroke?"
Barry's wife immediately called 911, and paramedics in the ambulance activated telestroke technology to connect with stroke neurologist Dr. Gary Belt.
And then they explained to me, "Barry, we have this technology. The doctor's going to be treating you in the emergency room. He's going to talk to you right now over this monitor."
Dr. Belt was able to begin assessing Barry's condition en route to Overlook Medical Center.
All doctors to the ER.
I was able to evaluate him en route to the hospital. Well before he arrived at the hospital, I knew he was having a very large stroke. I knew exactly what I was going to do upon arrival.
Within 14 minutes of Barry's arrival at Overlook, the stroke center team administered TPA, a clot-busting drug which dissolved Barry's clot.
As soon as he hit the emergency room, he was in CAT scan within 2 to 3 minutes, back in the emergency room soon after, and within 14 minutes, he received TPA. All told, he probably got TPA less than 1 hour from the onset of his symptoms.
Without telestroke, how long would that have taken? You would have had to wait for him to arrive before you start any kind of treatment or evaluation.
Well, to give you an idea, nationally, we consider it good if we can get patients TPA within 60 minutes of hitting the emergency room. But if we're losing brain cells every minute, 2 million brain cells every minute, time is brain. So it was very important to get him treated as quickly as we could, and 14 minutes is a good time.
As a result, he regained speech and movement in his arms and legs.
How many?
3,
Now?
4, 2.
Excellent, okay.
Exercise I was doing prior to the stroke.
Which is?
Low intensity, basically, but probably the most intense thing I do is walking the golf.
And Barry made a miraculous recovery. His follow-up studies were completely normal. He had no deficits. If TPA was not administered, there was the potential that Barry would have been unable to talk, unable to move the right side of his body, and have to live in a nursing home for the rest of his life.
They were ready. And then I learned later on that this technology with the monitor in the ambulance and the protocol that Dr. Belt took me through indicated exactly what stage or level of the stroke that I was in. And then there was communication to the staff in there, and they were ready.
Today, just 3 short months after his stroke, Barry is back out on the golf course.
I am forever in their debt. I felt I was being taken care of. The fact that I lived 20 minutes away from Overlook and their stroke center, and I think that was divine.
Dr. Gary Belt predicts that telemedicine will continue to gain momentum as a powerful tool in treating patients.
Telestroke and telemedicine is revolutionizing medicine, again, supplying quality care at a very quick period of time to remote places that normally wouldn't have that degree of care.
Knowing the symptoms is only part of the preventive equation. There are factors that contribute to an increased risk of stroke. Other risk factors include high cholesterol, high blood pressure, diabetes, smoking, and lack of physical activity.
Although there's a lot still to be learned about the role of diet in stroke, we can say in general a few things. You want to eat a healthy, varied diet. You want to avoid processed foods where you can. You want to avoid high sodium or salt foods, especially if you have high blood pressure. And certainly if you have diabetes, you should follow a diabetic diet to keep your sugars under the best control that you can. Exercise and maintaining an active lifestyle will go a long way to preventing disease and also making you feel better on a daily basis. The brain is what makes people special. It's where our personalities reside. It's where our ability to speak and enjoy life is. And also the things we don't think about: eating, walking, speaking with your family, playing with your family. There's nothing more precious than your brain and the functions that it performs. And there's nothing more devastating than the loss of that function. So it's really important that you do everything you can to protect your brain from stroke and other diseases.
The fragility of life has taken on new meaning for Yarmila and Barry. Both stroke survivors are embracing every moment, knowing they beat the odds. Knowledge is power, and we hope you've learned valuable information to share with your family and friends that will allow you to help save a life if ever found in a stroke emergency. Be well, be safe. I'm Tamsin Fidel. Thank you for joining us for Stroke Every Second Counts.